Nurse Nia here, and welcome back to In the Break Room. So I know those RN residency interviews are rolling around and you are wondering how you are going to be successful. Well, stay tuned and I'm going to give you tips on how you are going to ace that RN interview. All right, so let's get right into it. Number one, I would say that it's very important to know the goals and the mission of the company that you are interviewing for, okay? So upon interviewing, they'll probably ask you questions and they want your questions to kind of align with the goals and the mission of the company, okay? And then even past that, you'll kind of look uninterested almost if you don't know anything about the company. So I think that's always important to go back and review the goals and the mission, all right? Usually it's in the emails that they send you, it's embedded in there, so you don't have to look far. But just that little bit of effort could be the difference between you being hired and you not obtaining the residency, okay? Next, the company 9 times out of 10 is going to email you interview instructions. You will know the place that you should be at, the time that you should be there, and the attire that you should be wearing. I cannot stress promptness enough. Please be on time to your interview. As a matter of fact, please be 20 to 30 minutes early to your interview. That way you have time to clear your head and you also have time to speak with your peers and kind of prep for the things that you should be looking for them to ask you in the interview, okay? So promptness is always key. Next, I would like to talk to you all about attire. Please, 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 do not show up to your RN interview in a scrub. That is for when you have been hired and you are working with the company, okay? You want to make sure that you're wearing a dark colored suit. I suggest dark gray, navy, or black. Fellas, make sure you wear a belt. Ladies, if you decide to wear a skirt, make sure it is below the length of the knees and you can sit down comfortably in it, okay? Make sure that you're wearing a conservative hairstyle, so either have your hair pulled back or have it behind your shoulders, okay? So the interviewer isn't really distracted by anything else that you might have going on. Lastly, I would say wear conservative shoes, ladies. I would say wear flats or kitten heels, 1 to 2 inches. Please do not show up in 6-inch heels, okay? That is not interview attire. Flats, more comfortable than kitten heels, so I would go with the flats, honestly. Lastly, please do not wear nails to your interview. Wear a nice clear coat of polish if you need to, but outside of that, that's all you really need, all right? Body mechanics, always really important. You want to make sure that you're sitting up straight, your hands are folded in front of you or they're on your lap, and you're making good eye contact with the interviewer. Eye contact is one of the best indications that you are paying attention, and this is an opportunity, okay? So you want to convey to the interviewer that you are elated and excited about this opportunity, and you are the man for the job, all right? Or woman, sorry. Clinical experience. So your interviewer in any RN interview is going to ask you about clinical experience. So it'll come up maybe in the form of name a time when or describe a time when. They'll ask you about both positive and negative experience, okay? So you want to make sure for each negative experience, you come up with a positive resolution. So be thinking about that in your mind. Maybe a time that you had a difficult patient and you pretty much had to come to not even a consensus, pretty much had to come to a way to solve the problem, all right? So make sure that you have your clinical experiences in mind already, all right? Your strengths versus your weaknesses always comes up in RN interviews. So I want you to make sure that you name off more strengths than weaknesses and you make your weaknesses almost look like a strength. So for me, I would say I pride myself on being able to know when to ask for help, okay? You want to make sure your patient is always safe, you are safe, and you are protecting your license. If you do not know how to do something, please seek out the appropriate resource and then come back and carry on with your effective patient care, all right? So that's a weakness made into a strength, all right? Last but not least, I want you to set yourself apart, okay? So basically for my RN interview, I bought a business card. And I know you're thinking business card, they're like Cadillacs, everyone has one. But in actuality, everyone does not have a business card. And I can almost guarantee you 9 out of 10 student nurses won't have one. And this could be what sets you apart from your counterparts, all right? So basically, I'm trying to get to where you can see it. I have my alma mater, I have my full name, I have a number that I can be reached at, and then I have an email, all right? Let's see if I can zoom back. So you want to make sure that you have something that'll set you apart. Even if it's not a business card, if you come up with something else that's professional that you think will be good for you, then I would go for it, all right? So this business card, my interviewer was so excited. She asked me if I had extras so she could show the young ladies that she's mentoring. So I think this is a really great tip. All right. Last but not least, I'm sorry, I said that before, but this is actually the last thing. Ask a question. I don't care what you ask. Please ask a question, all right? So the questions that I asked on my RN interview for residency were, what are some of the tasks that you see that the new grads struggle with, okay? So you kind of are already prepared before going into the clinical setting and what you know that you want to make sure that you can do, all right? So if you already know what the new grads are struggling with, even if you start out to struggle with it, you can pick it up pretty quickly because you already know this is kind of an area where, this is kind of a rigorous area, and this is what I need to make sure that I'm focused on and make sure I am able to do, all right? Another great question is, what are some of the more common comorbidities seen on your unit, all right? So if you're interviewing for a renal unit, obviously end-stage renal disease, diabetes, mellitus. But I mean, it'll still let your interviewer know that you are interested in seeing what the nurses see on their day-to-day and interested in knowing how you can prepare for these type of comorbidities, okay? The last question I would say is really important to ask is, what is the nurse-to-patient ratio? The nurse-to-patient ratio is going to tell me how many patients that I will be expected to have per day, and it'll let me know if my license is in danger, okay? Having too many patients is dangerous. There is no way you can give effective patient care if you have 8 patients. Like, it's just not possible, okay? And as a new grad, you don't really know your setting, you don't know where your supplies are. Some of the medications you're giving, you're not even sure about, okay? So make sure that you inquire about that nurse-to-patient ratio. So let's sum it all up. A, we are going to know the company's goal and mission. B, we are going to be prompt. We are going to have the correct attire on. We're going to be early, actually. We're not going to be prompt. We're going to be early, 20 to 30 minutes, right? Our body mechanics will be on point. We will make great eye contact with our interviewer. We will have clinical experiences to reach back to. We will know our strengths versus our weaknesses. We will ask questions, and we will set ourselves apart, all right? So those are all the tips that I have for you, ladies and gentlemen. Good luck with your RN interviews. I know that you are going to ace it and obtain that great RN nurse residency job. Please, as always, like, comment, and subscribe. Thank you for your time, and I'll see you next week on In the Break Room with Nurse Nita. See ya.